Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor for the University of Kansas Medical Center. This is Open Mics with Dr. Stites. Our topic today is measles. It's extremely contagious and extremely preventable, but it's making a rapid comeback here in the United States. Joining me in the studio today is Dr. Dana Hawkinson, infectious disease specialist and medical director of infection prevention control here at the health system, also known to everyone else as Doc Hawk. We're also happy to have Dr. Doug Swanson from Children's Mercy Hospital here in Kansas City. Dr. Swanson is a pediatric infectious disease specialist and the interim division director of infectious disease at Children's Mercy. And joining us virtually is the esteemed and our excellent partner, Dr. Greg Polin. His many titles include Director of the Male Vaccine Research Group. He is also the Emeritus Editor-in-Chief of the Scientific Journal Vaccine. He is also a professor, a Presbyterian pastor, and I am a failed Presbyterian, just so you know, Dr. Polin. Don't hold that against me. We could go on and on. He's also been a good friend of this program and worked with us many times throughout COVID. We are delighted to have Dr. Polin back on the program.
Good to be with you.
It's good to have you back. All right, up until recently, vaccination rates have been so high that we just didn't see much measles. I'm just curious. Dr. Polin, have you ever treated or seen a case of measles?
Well, my own when I was a child, I remember that pretty well,
I had that
actually.
when I was really young.
And I saw one case early in medical school in the 1970s, and that's it. Haven't seen one since.
Yeah, nor should you. Have you seen any?
I've seen 2 cases of measles, and when I was a medical student, 1 case of subacute sclerosing panencephalitis.
Okay, well, that's the one you really don't ever
that
want
one
to see.
was really sad,
really
very
awful.
sad.
Yeah.
Yes.
Really awful. And Hawk, have you?
I saw one case in 2017. I think it was here. It was in a returning traveler, older patient that was not vaccinated. But, you know, as I tell my colleagues and other people that I work with, you know, really my mentor, Dr. Hinthorn, was probably one of the last people to see really actual measles cases in practice, and he's one of your friends as well. So shout out to Dr. Hinthorn. But the point is, yes, it is extremely rare, has been rare in the United States, and unfortunately, I don't think we're headed that. Could continue that.
The CDC officially declared the measles was eliminated in the United States back in the year 2000. Now, that's only happened with 2 other diseases, polio and smallpox. Now, Dr. Polin, what has to happen in order for a disease to be declared eliminated? And will measles lose elimination status? I guess it already has.
Yeah, well, we're very, very concerned about losing that. First of all, you need a robust surveillance system. You need to know, are you seeing cases and are they measles? So that's sort of the background. And then what you have to have is documentation of interruption of indigenous transmission for at least 12 months. And you're right, Dr. Stites, we are very likely going to lose that. And that is a real shame, because achieving that in 2000 was a monumental public health achievement.
Yeah, and the part that concerns me is that people think that measles is easy, but measles can be really bad and really deadly, and we'll get into that in a moment. You know, the first smallpox vaccine, according to this script, says it was back in 1796, Dr. Polin. Talk to us, is that really true? Of course, it was killing 400,000 people a year back then.
Yeah, it was true. In fact, if you look during the 20th century, just the 20th century, over 300 million people died of smallpox. The reason you're seeing those numbers of 1,700 is, remember that General Washington ordered variolation of the Continental troops. So it's been around a long time. Interestingly, a lot of pastors supported smallpox vaccine. Cotton Mather, a prominent Puritan preacher, his house was actually firebombed by anti-vacciners, even back then.
Gosh. So how did we have a vaccine back around 1796? That just seems so darn early. Did they even have microscopes? I'm trying to remember.
Yeah, well, you know, it goes back to Edward Jenner, who pricked young James Phelps' skin with cowpox and demonstrated that you could protect against subsequent smallpox. Now, he wasn't the first to do that, but an important lesson for all of us in academia. He was the first to publish it.
Oh, excellent. I don't think I've ever been accused of having to worry about being first about anything. My wife really says I'm never first to any event, so I don't know what that could be. So now, like smallpox, measles is a highly contagious respiratory virus, and the degree of contagiousness here makes COVID look like an amateur. It is miserable for people with even the mildest of cases because of the rash and high fever. Measles can also cause much more serious complications. We've heard about seizures, hearing and vision loss, permanent lung damage, immune amnesia, which means your immune system turns off. It can have severe brain damage and death, and you can lose your ability to reproduce. So how do we go from this highly contagious threat being eliminated in the year 2000 to outbreaks happening now across the United States, including Kansas and Missouri? Angie Racono has a timeline of these notable and probably depressing events.
After being declared eliminated in the United States, measles started making a comeback in 2008, and it started with an unvaccinated 7-year-old who traveled to Europe. He contracted measles, brought it home, and spread it to 140 other unvaccinated people. In 2011, 220 cases of measles were reported across several states among unvaccinated individuals. In 2014, an under-immunized Amish community led to 667 reported measles cases. A trip to Disneyland in 2015 led to an outbreak involving 191 cases across multiple states. In 2018, an outbreak in New York City and the surrounding areas led to 423 cases. Then in 2019, the country faced our largest outbreak of 1,271 cases across 31 states, and this was just before COVID hit. Then next year, in 2020, the number of cases dropped dramatically to 13, with much of the nation on lockdown during the pandemic. By 2024, measles cases started shooting up again with 285 confirmed cases. And that brings us to 2025, where an ongoing outbreak that started in Texas could continue for months, based on studies of how measles previously spread.
Dr. Swanson, how does the current resurgence of measles compare to other recent measles outbreaks? What's different? What's the same?
I think this time it's larger outbreak that we're probably anticipating. It's already very big, and it's just getting, it's still rolling and not well under control. So it's probably similar more to the 2019 outbreak that occurred primarily in New York State, New York City, in an under-immunized community. And so this outbreak currently going on, it's in western Texas, and it is also in an under-immunized community. So it's very similar in some respects to the 2019 outbreak.
And as I recall, during COVID, we said you needed to get herd immunity. You got to be over 85% of people protected with vaccination, et cetera.
Like 95%.
Or 95%,
Yeah.
Okay. And the numbers in like Texas, I think the rate of vaccination got pretty low,
Yeah.
like in the below 80, down in the 60s
Correct.
and 70s.
Yeah. And so there are pockets of communities that are under-immunized where it can start to spread and then get into areas of the communities where individuals, like infants who are too young to be vaccinated, or people who are immunocompromised and at greater risk for measles, and so it can continue to spread that way.
Dr. Poling, vaccine skeptics claim the MMR vaccine used today is different than the one originally approved by the Food and Drug Administration, and therefore, so they say, we don't know how safe the MMR vaccine is. What do you think?
Yeah, that's really, Steve, that's really part of this mis and disinformation. Thank goodness the original measles vaccine that was first licensed in 1963 was withdrawn from the market. It was an inactivated viral vaccine, and what we've learned very quickly with the use of that vaccine is it didn't protect very well and led to an unusual situation called atypical measles. The vaccine we've had since 1968, on the other hand, has been, so that's a long time, since 1968, has been well documented to be protective and to have minimal side effects. So it always bothers me when people say, well, isn't natural immunity better? And when I was a kid, I don't remember anybody dying it, but let's just look at the statistics. Before there was a measles vaccine in the U.S., essentially every child got it, so 3 to 4 million people a year. 48,000 of those kids ended up sick enough that they were hospitalized. 1,000 of them developed encephalitis, and 500 of them, on average, each year died. That's what, quote, natural immunity gets you. Contrast that with the risk of vaccine. There's no comparison. You can have a few cases of low platelets, transient fever, maybe rash, and that's it if you're otherwise normal, healthy individual who receives the vaccine.
You know, it just, I don't understand why people want to spread poppycock. It's like they just kind of made the poppycock up, and they want everybody else to believe in the poppycock, even though the reality is what you have just described. And why would we want our children to be hurt like that? And this link to autism, poppycock, right?
You know, there have been well over 20 studies, some of them with just superb study designs, across more than 2 decades, across multiple countries. I say it that way because us as physicians and scientists, the hallmark of science is repeatability, getting the same finding every time, and generalizability. It holds true no matter where we look. Every single one of those studies have failed to find any link whatsoever with any aspect of autism.
Dr. Hawk, throughout COVID, we had to deal with this kind of stuff with vaccination, and everybody was afraid of the messenger RNA vaccine, et cetera. What are your thoughts about this poppycock around? I love my term, poppycock.
Yeah,
poppycock
yeah,
around,
we need to say it more, for sure.
It's a new. It's coming back.
We're bringing it back
with measles.
Yeah, that's unfortunate.
Yeah. So what is your thought about all the disinformation in the poppycock?
I think that goes to the context we are living in right now in current times with the spread of measles. Why is that happening? Why is this different than 2019? There are major points and reasons why this is much different. I think it is in the context of extreme disinformation and misinformation and mistrust of medicine and public health, mistrust of science. We have to get back to knowing and understanding what is true, but it is just so difficult out there. And so that when you have this culmination of factors, now in the context of our current times, since the pandemic, with decreased vaccination rates, decreased wanting to listen and adhere to medical guidance and recommendations. We don't do that for when we listen to our plumbers, our mechanics, our lawyers. People are really readily wanting to listen to that advice. But when it comes to medicine, for the most important thing, your body, your health, it seems to be a contradictory attitude. If you don't want to listen to this because I see it on TikTok or on Facebook. But it's unfortunate. So in the context now of the pandemic and not trusting medicine and science more, you have a decreased overall vaccination rate, not just for uptake of influenza and COVID vaccines, but also for those most vulnerable, those children, those pediatric patients who now are not vaccinated. And in this context, we have decreased overall vaccine rates. So decreased herd immunity, as we had just talked, wanting that 95%. Many areas locally here in Kansas and Missouri are down to 90%. But many areas in the nation are down to that as well. And so you have this continued spread. You will only see more patients developing this disease. And unfortunately, the complications that come along with it. And also, as we have seen now, 3 deaths as well. And so I think that is important to understand is the context to which we are dealing with it in the current times as opposed to 2019.
And have you had families say they don't want to be vaccinated, they don't want the measles vaccine?
Not so much the measles vaccine. It does happen, but I would say it's really influenza and COVID-19 where there's a lot of vaccine hesitancy and resistance.
What are your colleagues saying with children? I mean, I'm sure you go to these pediatric infectious disease meetings, and this has got to be a prime focus. What are the strategies for trying to get people back to thinking, yeah, my kid needs to be vaccinated against measles?
So, the strategies are often first trying to identify, are they vaccine hesitant? So they have questions, concerns, but they are parents who are willing and open to hearing the pros and cons of vaccinating or not vaccinating. But there are some who are just vaccine resistant, and they're going to be resistant to any kind of education. So it can be challenging to try to convince those parents to vaccinate their children. But for those who are vaccine hesitant, there are really good resources available for parents. People often mention the CDC, and the CDC does have good information, but the Children's Hospital of Philadelphia has a vaccine education center, and they have some really very user-friendly information, I think very well-balanced information for parents to go through online and learn about. And then many experts recommend pediatricians, when they're seeing children for their well-child visit, for their vaccine visits, basically say, at today's visit, we have 3 shots. It's going to be this one, and that one. And these are some of the reasons why the vaccines are being used. Here are some side effects. Do you have any questions? As opposed to sometimes it's, well, we have these vaccines available. Would you like to get them? It's really more of an approach of, this is what I'm recommending. This is what you should do. And then if they have hesitancy, they can answer their questions about it.
Dr. Pullen, you look like you had another comment too.
Yeah, no, I agree with Dr. Swanson, and to put a word on what he's saying, it's really trust building. I might add just one thing to what Hawk was saying. You have to finally settle on a worldview, and for matters of medicine and science, the one that is most coherent is the scientific method. If you reject the scientific method for matters of medicine and science, you're in a world of hurt, because then it's opinion. It's what I feel. It's what somebody told me who has no expertise. And that's a very dangerous place to be, and people get hurt when we abandon the scientific method.
I remember sitting in a conference and somebody said, we should all be giving ivermectin to patients on ventilators with had COVID, because I gave ivermectin and a patient got better. So therefore ivermectin works, as opposed to saying a patient got better. Yeah. He may have been on ivermectin, but he was also on fluids and antibiotics and this and that. But oh gosh darn it, it was the ivermectin. Somebody has autism. Well, it's the vaccine. And people say it with such certainty, but there is no scientific method, because if you sit back and you compare all the kids got vaccinated, all the kids that didn't, there's not a higher rate of autism than the kids who got vaccinated with the measles vaccine. So, but it's like people make their minds up and they don't want to listen, so instead they believe in the poppycock. And the trouble is the poppycock doesn't protect you from a deadly disease and doesn't help you when you get sick. But inevitably what strikes me is people who believe in the poppycock, when their kids get sick, what do they want to do? They want to come to the hospital and they want their kid to get treated and they want to have all the science in the world. But they missed the boat on the science that was going to stop their child from getting sick. Okay, well, that was a strong one right there. Okay, so there's a lot of focus now on the acute measles infections, and we mentioned immune amnesia a minute ago. Dr. Swanson, talk to us a little bit about what immune amnesia is.
So immune amnesia is a fairly more recently identified process where the measles, wild-type measles, when you get it, can inhibit the memory cells of your immune system. And those are like the T cells and B cells. So the T cells are not as functional. The B cells are not making the antibodies as well. And so you have decreased protection against things that you used to be protected against. So you may have had protection against chickenpox. You may have now lower protection against chickenpox. And that can last for many months and even years. So there's sometimes, again, going back to the natural disease immunity versus vaccine immunity, you're facing lots of complications and risks, and that is another risk that is not as well recognized, but you can be susceptible to other infections after you've had measles.
And I will say too, there has been some recent studies. So measles is certainly, we haven't seen it in the United States a lot, but Europe and other places around the world have. There are some really good recent publications out from Italy especially. They have been dealing with some measles outbreaks. I think there was a 2020 or 2021 study showing that, in fact, that when kids, after they get measles, because it is a lymphotropic virus, meaning it searches out those white blood cells, just as we heard Dr. Swanson talk about, you then destroy those cells. And those kids that then got measles were more at risk over the next couple of years of going to the hospital for things like infection as well. So there is good data
one more reason
support
to not
that.
believe in the misinformation. So
to put a number on that, there was a 4-country study that followed kids for 2 to 3 decades, and in regards to this aspect of immune amnesia, that phenomena was implicated in about 50% of all the subsequent childhood deaths that occurred due to infections. So it's a real phenomena that has real consequences.
Well, and speaking about death and severe consequences, SSPE is a 100% fatal brain disease. It may not show up for 7 to 12 years after an infection. Dr. Poland, talk to us about that. What is SSPE, and why does it take 7 to 12 years to show up?
Yeah, this is a really interesting phenomena. It's an area of active and growing research. The best we understand this SSPE phenomena to be is that after infection in some people, and we don't necessarily know what the risk factors are other than younger age when you get infected, the virus becomes defective, chronically infecting the brain, leading to inflammation, neuronal cell loss, and a gradual onset of seizures, motor difficulties, dementia-like aspects, personality changes. And as you mentioned, and unfortunately, it is 100% fatal. There is nothing you can do other than prevent this from the very beginning by getting your MMR vaccine.
Isn't it frightening if your child is getting measles today? It doesn't need to happen, but you have to worry about that if your kid gets measles. Okay, I survived the measles. Well, actually, maybe you didn't, and you won't know for quite a while. That's tough. Now, Dr. Hawkeye, breakthrough infections after vaccination can occur, but they're usually pretty mild and not very often.
Yeah, no, I think that's right. And I think certainly want to hear Dr. Poland's comments on this as well. But I think this is where we now have learned from our messaging about vaccines, especially from the COVID pandemic. So what about this vaccine? So we heard the historical numbers. If you've had 1 dose of MMR, you are 93% protected from the disease. Again, vaccines are meant to protect you against disease, not necessarily infection. So we are looking at preventing disease and its complications. If you've had 2 doses of the vaccine, historically you are 97% protected against the vaccine. That means there's probably a breakthrough rate of about 3%. So 3% of people may get the disease, but just as you said, there are more mild symptoms. In addition, there is good data to support the fact that you are less likely to be able to spread it in the way that an unvaccinated person will spread it as well. So it is about decreasing your risk of complications with this vaccine, decreasing the amount of disease, but that was also in the context of really good vaccine coverage overall, 95% or more. So again, we can probably expect to see some breakthrough cases, which we have, but it's very, very few. It is in that 1 to 2%, I believe, from the most recent outbreaks. But that disease process is going to be much less, with much less risk of complications. And of course, the ability to spread it's going to be less as well.
All right, we're going to talk more about the current outbreaks here in just a second. A quick reminder that you can send us questions. Use the methods on your screen, YouTube, Facebook, or email the Medical News Network. All right, Doc Hawk, as of today. Oh, that's your theme there. It's got the little, I like how the little wings fly on that. That's pretty good. That's good.
We have a great production crew.
It is a great production crew. All right, as of today, we have not seen a measles case that we know of in the Kansas City metro. What's happening outside the metro?
Certainly we know in Kansas, as far as southwestern Kansas, we do have over 30 cases. Certainly new numbers will be released today for Kansas, but more importantly, in the nation as a whole, around 900 or more measles cases with quite a few, I think it was over 600 measles cases with the Texas and New Mexico outbreaks. We now have also seen exposures other places. We know that there is local spread within Arkansas. I just saw an article recently. So I think we are getting to know and understand that this virus now is out there being spread more, but also in the context of travel. So we know that other places I mentioned, Europe and other places around the world, are seeing an increase in a surge in cases as well. And we have to expect that that will continue as we continue to have low vaccine counts. So I think we just all have to expect that there will be more cases. Unfortunately, there will be more complications as well. And unfortunately, we probably will see more deaths. We are looking at 1 to 3 deaths per 1,000 cases of measles. So far, we have seen 3 in the United States. And any one death is tragic when we are talking about this disease, which is so easily stopped with this most safe and efficacious vaccine.
Dr. Poland, they've talked about undercounts on the number of measles cases. Talk to us about why that. First of all, what is that, and why would that be?
Yeah, the estimates are that we don't just have the 900 cases we have. Let me put it this way: are confirmed cases. There's probably double to triple that number of cases, and the primary reason, at least if we look in the Texas and New Mexico or these pockets where there's a lot of vaccine rejection, is primarily political and cultural. Once one of their children has measles and then they start to see measles in their other children, they don't take them for medical care. They don't take them for testing. And there's a variety of reasons why they don't want the authorities to know that the rest of their family has measles. So it is a systematic undercount. The other point, and Hawk is right, this is just tragic. We have to remember that these deaths, these hospitalizations, these complications are occurring in unvaccinated or undervaccinated. 97 and 98% of these cases have never been vaccinated against measles. So this is a simple fix with a complicated cultural aspect to it.
Yeah, I think you described that really well. And Dr. Swanson, you had some thoughts there about what to do, but are you seeing a rise in vaccine hesitancy in the patients through Children's Mercy?
I would say yes. Again, it's primarily focused on the seasonal influenza vaccine and COVID-19, but also other vaccines. The DTaP, whooping cough, that you mentioned how sometimes people who are not wanting vaccines for their children, and then they want medical care when their child gets sick. Last month, I got a phone call of a family that had been back to the doctor in the emergency room multiple times because whooping cough in all 3 of their children. And by the time there's no treatment that you can provide for whooping cough. It's called the 100-day cough.
Right.
They will cough and cough and cough and be miserable. And unfortunately, could have been prevented, but was not. And by parental choice.
Natural immunity can work, but sometimes it's not the only choice. If you think about the complications that we've described, why are we thinking that its only choice is that? All right, let's switch gears to another vaccine for just a moment. Recommendations may be changing for this fall's COVID vaccine. Advisors of the CDC have discussed recommending it only for people at high risk, like immunocompromised or older adults, like me, I guess. Dr. Poland, what's your take? Why are we seeing the potential change? Why is there a debate?
Well, I think people are saying there's a lot of immunity in our culture right now. People have had varying numbers of primary and booster doses, varying numbers of infection. So for an otherwise well person, you could kind of see your way there. But, we don't do that with influenza. We don't do that with other vaccines. And they're looking at deaths and hospitalizations. But there are other aspects, there are other complications, and chief among them is long COVID. Wow. Long COVID is a real issue, and particularly in younger women. Are we really going to say we're not going to make a vaccine available to you? I have great reservations about that.
Yeah, I'm with you, especially for younger women and for women who may be pregnant. Come on, let's not incur risk when there really is no risk from the vaccination, or minimal risk. And I know I've had COVID myself a couple of times, and I'll tell you that long fatigue afterwards, it can be real. And I was just grateful that I've been vaccinated. I can't imagine what we're seeing, especially in the unvaccinated population, with this ongoing long illness and chronic fatigue thing. So, well, let's head to Studio B with Alexis Del Cid, watching for questions from our viewers. Alexis, how are you this morning?
Doing well. How are you doing?
Excellent. Happy to be with you.
Happy to be here. I've got a great question from Sean Curry. Sean wants some clarifications on who should get revaccinated. He writes, does it make sense to get vaccinated again for measles if I was vaccinated as a child? I'm 58 years old.
Dr. Poland.
Well, here's what we would generally say. If you were born before 1957, then you almost certainly had measles and you're safe. If you got immunized between 1963 and 1968, it's unclear whether you'd be protected. You've got two choices. One would be to get an antibody test and find out whether you have immunity to measles. That can be rather expensive and a little bit difficult, or simply get another dose of MMR vaccine. So every adult should have, that wasn't infected, should have at least one dose. And for those that are in particular situations, like us as healthcare workers, military, college, etc., 2 doses of MMR vaccine.
So if he's...
So can I just ask real quick, what do you say to the people like me who are born between 57 and 63? And what do you say to folks of that nature, and especially if you think you had measles?
Well, if you had measles, we can test, and we can know for sure. Otherwise, you got to get vaccinated.
Back to you, Alexis.
Leslie Myers wants to know, how does measles spread?
Measles spreads primarily 2 ways, through droplets, but also aerosols. So aerosols means it's in the air. So when people with measles are coughing, the virus gets into these very small particles in the air, and they can float in the air for many hours. And so the rule of thumb is, if you had a patient in your exam room who had measles, you need to keep that room empty for 2 hours, because anybody who goes into that room before the 2 hours could be exposed to the measles virus.
And it's got a very high degree of transmission. So if I go in that room and I hadn't been vaccinated, I breathe it in, I'm pretty likely to get it.
Yeah. You know, 90% of people who are not protected against measles vaccine, if they are exposed to somebody with measles, they are likely to get measles.
This is one of those diseases that just, likes the lungs, likes the airway, and boom.
It's one of the most contagious diseases that we have.
Yeah.
Hey, Schoenberg has a question, and this is going to be interesting to hear if you have a child with Down syndrome. She wants to know if something she heard is true. Kay writes, I've heard that if a baby has Down syndrome, there's a particular concern about the binder in the MMR vaccine, and that it would be better to get the vaccination separately. What do you think about this?
Well, first of all, you can't get the vaccine separately. Measles vaccine is only available in the United States as MMR. And so that's not an option. And there's no evidence that there would be a contraindication for the MMR vaccine for somebody who has Down syndrome. But Dr. Poland, he looks eager to weigh in also.
No, absolutely agree with Dr. Swanson. In fact, Hawk and Dr. Swanson would know better than I. I don't really see children. But Down syndrome children have some propensity to infections. And so it would, in my mind, be a reason to urge one to be vaccinated rather than to avoid it.
I agree.
And then for her question, should she get all the vaccines at one time that babies typically get, or should she space them out?
I would stay with the regular immunization schedule. I would not space them out, because you're just risking exposure to one of those diseases while you're spacing them out and waiting to give the vaccine.
We have a question from
Alexis. I am surrounded by brilliant people. This is awesome.
I know, right? What a resource.
What
a gift for our viewers.
I know. I could just sit here and say poppycock. Go ahead.
Well, you're pretty brilliant yourself, Dr.
No,
Stites.
no, I'm poppycock. Go ahead.
Sophia has a question. She has a question about the MMR vaccine. She writes, I've never heard this before. What about people whose bodies will not accept the measles vaccination? She goes on to share, I've had the vaccination 12 times, but the titer tests keep showing no evidence of vaccination. What is going on with that? And then after you answer her question, can you explain to our viewers what is a titer test?
Well, Dr. Poland, let's start with you, and then I'm going to flip over to Dr. Hawk in a second. Go ahead.
Well, she is right. And if doctors have told her that she's wrong, she's probably not gotten good advice. I've studied this. I've seen patients like this who don't seem to respond by antibody tests. However, that antibody test, just testing, measuring the amount of blood, antibody in the blood, or so-called titer test, and we know a cutoff for protection, that does not measure cellular immunity. And unless she's immunocompromised, it's very likely that cellular immunity is intact. And that can be tested in a laboratory. It's not a standard clinical laboratory test, but it can be tested.
And Hawkeye, you and I talked about this, I think, a few times before with COVID, whether people got the antibody or did they actually have that cellular response with their lymphocytes.
Yeah, I mean, I can't follow that answer. I mean, it's perfect. It's true. We have talked about this, and it is simple immunology, cellular immunology and protection, and then the humoral, which is the antibodies. And so, these tests that we create for anything, any of these diagnostic tests, they're not perfect. And so we do miss some of those because of the sensitivity of the test. But to Dr. Poland's point, we know and understand that cellular immunity, those T cells, are vitally important for protecting against severe disease, particularly for COVID, but also for these other viruses such as measles. And so I think that is the important thing to remember. More than likely, unless you are immune compromised, as we heard Dr. Poland talk about, you have that cellular immunity to protect you against severe disease. And what we also have learned from COVID for that particular infection is that cellular immunity actually kicks into gear even quicker than the antibodies do when you get that vaccine as well. So the cellular immunity is vitally important. You may not have the evidence of that because the test is just an antibody titer test. But if you've received the vaccine, and unless you're immune compromised, there's probably a very good chance you will have that cellular immunity.
And you'll be okay.
And you'll be okay.
Yeah, okay.
Vera has a question about the flu vaccine. Vera McLeod wants to know, what other options are there for the flu vaccine if your body doesn't respond well to the vaccine? It seems to attack the muscles in my legs for long periods of time, up to 6 weeks.
Okay, Dr. Poland.
It's a little vague. I'm not exactly sure.
Yeah.
I mean, there certainly can be rare neurologic complications from flu vaccine, so there's that maybe sitting out there. I would tell her that there are multiple types of flu vaccine, so we could try different types of flu vaccine. If she absolutely can't tolerate it, and I don't think that's the case, but if it was, there are antivirals that we can use, particularly if she's high risk. We can give them to her throughout the flu season. Don't generally like doing that. Or there's home testing now. So the moment she had symptoms and was confirmed to have influenza, we could treat her influenza.
We have one more question from Milo. Milo wants to know if there is any research on treating measles with home remedies like vitamin A and fish oil.
Okay, I'm just going to say it. I'm going to pull my hair. No, I don't have any hair to pull out, really. I'm going to pull out Hawkeye's hair if we continue to think that the answer to measles infection is vitamin A and fish oil, especially when you've already quoted all the deaths and all the challenges that happen for thousands of years with measles. I guess vitamin A and fish oil didn't work very well then, Dr. Poland.
Yeah.
Well, let me say that vitamin A does have a role in treating measles in people who are deficient in vitamin A. And that's been well shown in low and middle income countries. That's a different situation than here in the U.S., where vitamin A deficiency can occur, but is less likely to happen. Vitamin A is not a preventive. It will not prevent measles. It does not treat measles. What it does do is decrease the complications, as I said, in people who had vitamin A deficiency, and that is its only role.
Yeah, so I was going to say there are studies, but they've not been really in the higher income countries. It was low income, middle income countries to show that those countries where children who are low in vitamin A do have some benefit with vitamin A, but it's just at one dose for 2 days. So the problem I think that we've seen in this country is overdosing of vitamin A, and you can get something called hypervitaminosis, where you can have blurred vision and even liver injury due to the high doses of vitamin A. So the American Academy of Pediatrics does suggest using the vitamin A for children in the United States who have measles, but recognizing that it may not provide a benefit for them because most children, as Dr. Poland said, in the United States do not have a deficiency of vitamin A. Measles itself can sometimes cause a vitamin A deficiency. So it is, in 2 doses, one dose and then another dose the next day is safe and may help and probably won't hurt.
All right, this has been an absolutely great discussion today, and I do love being surrounded by brilliant people, and I'll tell you what, this has been a brilliant conversation because of the good folks we have today. And I want to hear final thoughts before we go. Doc Hawk, we'll start with you.
Yeah, I would say, we as physicians, medical professionals, even public health, our main goal is to first do no harm. And we practice evidence-based medicine with that understanding, do no harm. And I would say that there is overwhelming evidence of the benefits and the safety and the efficacy of MMR vaccine to prevent the complications of the disease of measles, but also of mumps and rubella as well. And we continue to do that, and we have to continue to endorse that and get that true and accurate message out there as we continue to fight against misinformation and disinformation, which is so readily available to the public, and continue to try and rebuild that trust of medicine and public health.
Dr. Swanson, final thoughts.
Dr. Hawkinson expressed it very well. I can only add that, in addition to physicians wanting to do no harm, I hope that community members will want to do no harm. And there are individuals in our community, very young children who are vulnerable to these diseases, to measles, people who are immunocompromised who are vulnerable to measles. So it's not just protecting yourself against measles by getting vaccinated, but it's protecting community members also.
And Dr. Poland, final thoughts.
2 thoughts. Number one is I personally don't know a physician in an academic medical center whose children have not gotten MMR vaccine unless they're immunocompromised. So that's one thing. Physicians get their kids immunized. The second thing is I kind of think about it is that, you think about a world without vaccines. That's a less stable, more unpredictable and meaner world where inequities get exacerbated. We stop caring for one another. People get sick, they get hospitalized, and they die. And where travel and school and work and trade are disrupted. In short, it's preventable chaos, confusion, disability, hospitalization, and death. And it need not happen.
It's hard to follow that because I can't tell you how much I appreciate your view and fully believe in that. And we want our kids to be in school, and that was one of the bad things about COVID is having to stay home. Well, if you have a polio outbreak in your school, if you have a measles outbreak in your school, you're going to have to keep your kids at home. And it's really, these are potentially deadly diseases. And I'm thinking about polio. When I first started in medicine in 1990 as a fellow in pulmonary disease, we still saw patients who had polio when they were children and had long-term respiratory illnesses. And it's like, really, you want to go back to that? You think natural immunity is better than that? Even though there's absolutely no evidence against the concerns that are being raised? So what we see is this whole story, which is really poppycock, against the truth that we have all experienced and lived on an ongoing basis. Because when you do believe in the combination of faith in each other, the hope that we can make things better, and the science that allows us to confirm that and affirm that, we can live in a much better place. Faith, hope, science. And having some smart folks around you, you know what, that's a pretty good thing too. So thanks to all of our audience for listening today. We'll be back again next week. Dr. Pullen, thanks again for joining us from up north, and have a great week, folks.
I'm Alexis Del Cid on the next All Things Heart.
If I didn't stop everything I was doing, I probably would have dropped dead at the gym.
The young man who faced his second life-threatening medical condition before the age of 30. The procedure and surgeon who saved him while stopping his heart for 4 hours. Thursday at 8 a.m.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.